are true for the clefts of the lips. So let us talk about the cleft lip and cleft palate. Now this is a very easy question. The cleft of, you can say, Pierre-Robin syndrome, if you talk about Pierre-Robin's. Now Pierre-Robin's is a condition where you get to see an isolated cleft palate. So isolated cleft palate, point number one. The second is, along with that, you get to see glossoptosis. You get to see glossoptosis. So glossoptosis, isolated cleft palate, and retrognathia. So yes, point number one is absolutely right. This is true. The second very important point is the most common chromosomal anomaly that is associated with this short arm of 22p mutation. This is, and most common syndrome which is associated is van der Waals syndrome. Van der Waals syndrome. Van der Waals syndrome. Actually, here you get to see clefts, and along with that, facial pits or sinus. Facial pits or sinus. There are a lot of syndrome. Now, when we talk about the management, let us see something on the timing of the management and the surgeries. So let us see, this is very, very, very important. So let us talk about the management of clefts. So when we talk about cleft, there are a lot of concepts on the timing of repair. We have one Delorme concept of cleft repair, timing, Delorme timing, and then we have Millard's concept of cleft repair. So remember, isolated cleft of lip can be repaired as early as 3 months. The range is 3 to 4 months is actually 3 to 6 months is the range where you can repair. Isolated cleft palate, and if this is a soft palate, so this should be repaired at 6 months. The range is 6 to 9 months. Then cleft of lip plus palate, this should be repaired at least at 6 months. The range is 4 to 6 months. The cleft of hard palate plus soft palate. Now here the controversy is, if you want to go for a single stage repair, you can repair it anywhere between 6 to 9 months. And if you want to go for a two-stage repair, this is very simple. In two-stage repair, the soft palate shall be repaired at 6 months. The range is 6 to 9 months, and just 6 months later, you can go for, so 12 to 15 months, you can go for a repair of hard palate. This is how we repair this is how the timing of cleft palate repair is seen. Then what are the surgeries that we do? When we talk about surgeries, we have surgeries for cleft lip and we have surgeries for cleft of palate. When we talk about cleft of lip, we have Millard's rotational flap. So Millard's rotational flap. Along with that, we have Z-plasty. So either you go for Z-plasties or you can go for a Millard's rotational flap. Yeah. When we talk about cleft palate, we have a single stage repair. When you talk about a single stage repair, that is Farlow's. So Farlow's is a single stage repair. And when we talk about two stage repair, we have Farlow's also and we have TCR's also. Remember, TCR's surgery is for this, and TCR's flap is a flap for eyelid reconstruction. So two stage repair, if you talk about, we have Wardell-Kilner. So Wardell-Kilner. So Tennyson's Z-plasty, or Millard's rotational flap. So let us go to this question. Cleft lip is repaired at 9 months? Never. It is repaired at 3 to 6 months. The best time is start as early as 3 months.